Welcome to My Spoonie Sisters, featuring stories from special guests dedicated to empowering those with chronic illness. Our goal? To connect people and provide the support and tools they need to live a better life. For those with chronic illness, our energy levels just fade faster. We must be more purposeful with the spoons allotted to us. So grab your coffee or tea, sister, and tune in as My Spoonie Sisters share stories of living with chronic illness. Hi, my Spoonie sisters. It's me, Gracefully Jen, and guess who I have in the house? Welcome to Kenzie, the rare mom. You've heard from her before. I had to bring her back. We're going to talk more about her. We're going to talk more about Josiah. Welcome, Kenzie.
Hey.
All right. How you doing, girl?
It's been a whirlwind since we talked last, just going through the motions, as a chronically ill adult with a chronically ill child. I feel like things change in the matter of hours or even minutes. So we have a lot to catch up on.
We sure do. And like I told her before we started the recording, let's consider this therapy. So if any of my Spoonie sisters just need some great therapy to talk about your stuff, just, reach out to me and we'll have an episode and we'll talk it out. I'm not a therapist. Please understand that. Okay. So last we talked, we gave a little bit of your background. We gave a little bit of Josiah's background, but let's kind of start with, okay, let's remind people, what are your diagnoses?
So at 13, I was diagnosed with juvenile idiopathic arthritis. I just recently got a new diagnosis of mixed connective tissue disease, which I found out from my rheumatologist can escalate to like RA or lupus or all those good, fun other diseases. And then I have a blood coagulation defect disorder. So that's a mouthful.
And you've been dealing with some current health struggles. So,
Yeah.
Where do we even dive into that?
So everybody knows when you have a autoimmune disease, it flares with stress and sickness and children or jobs. And my husband actually just left to the military 6 weeks ago. So that was a major change. Plus, my kids also have their own health ailments, and there's been winter break, so I'm completely stressed. So I've been dealing with migraines and extra bleeding and constant flares and the lovely magnitude of health issues.
And school on top of that all?
Oh, yeah. You can't forget about school, right? I mean, God, I wish it was over with already.
Yeah, I know. I want that for you. I just want you to be done because, well, first of all, I'm excited because you're going to the medical field, which I think is amazing, and you're going to do big and wonderful things, and I can't wait to see. But
yeah,
it's got to be absolutely exhausting going through medical school, being kind of the single mom right now, taking care of yourself, taking care of your children. You both have complex things going on. How the heck are you holding yourself together right now?
Well, for starters, I had to really take a break. I put my phone down the last couple weeks and I felt like I was just checked out. I was just over it. I was drained. I was just defeated. And I hate saying that, but sometimes you just need to shut out the world. Like I was still kind of active, liking, reposting, but my normal stuff I stopped doing for a couple weeks. I went back to therapy. I tried to talk normal therapy and they said that was not going to work for me because, healthcare people are the worst patients. They don't want to talk about anything and they're stubborn. So
No kidding.
I started the EDMR, I believe, therapy, and it is called rapid eye movement therapy. So that's always fun.
Walk us through what that looks like.
I don't even know because I feel like I try to black out because it's kind of traumatic. I mean, for me anyways, because I have a lot of deep-rooted childhood trauma, but you sit there with a therapist and they try to bring up your thoughts and reprocess it, and you just learn new ways to cope while you're like moving your eyes with a pendulum. And it depends the person. It's kind of like weird. I didn't know what to do the first time, and then it kind of brings up like vivid night terrors for me anyway.
That
And
sounds horrible.
it's for me, it's horrible, but I can tell that it's working. I'm in my third week, and the nightmares are like kind of like reprocessing the things that I went through growing up, and like the trust issues with my husband, because everybody has them in marriage. Like, if you don't have them, then you're lying. And I'm just learning how to cope better. I can see a difference, even though it's terrible.
Wow. Well, you're so brave. I just hearing you talk about it, it scares me to death. I mean, what kind of things have I not processed that maybe I need to, or maybe I don't want to? Okay.
It took a lot. Yeah. So.
So on top of that all, you also are having some bleeding concerns right now. So what does that look like?
Well, it's mostly girls who listen to us, so TMI, but with my blood disorder, I'm also a gene carrier for thalassemia, which my older son has. So I'm prone to like longer periods. I'm prone to bleeding faster, longer times, like gum bleeding, even when you're brushing light, or like nosebleeds. So I've had my period for 32 days. Yeah. So
that sounds absolutely terrible. I mean, 7 days was enough for me, and it was horrible. Dealing with endometriosis and all that. I mean, it was horrible. So I can't even imagine 30 plus days.
Yeah, it's been rough. And then like I've been having like really bad migraines on top of it, and they don't know if it's like hormonal or like the pressure in my head is changing from something else. So I have to go do a lot of imaging and blood work tomorrow.
Okay, so what kind of doctor are you seeing tomorrow?
My hematologist, and she's also going to bring in my gynecologist. Love it.
Okay. So are they going to have you see a neurologist because of the migraines?
Well, yeah, I see a neurologist right now, and lovely insurance, they are fighting my Botox injections. So, yeah.
Yeah. And I mean, I haven't had this done, but for those that are not familiar, they can do Botox injections in your scalp that help with migraines. And I hear that for some people that works wonders.
It's really hit or miss. For my mom, they work great, but for like my aunt and my grandma, they did not work good at all. So I'm just like, you know what? I mean, having 11-day migraines where medication don't work, I'm willing to try anything because it's debilitating. I can't drive. I can't take care of my kids the way I should. It's frustrating.
Are you on any kind of rescue meds?
Right now, I take Excedrin migraine. I'm not supposed to, because not many people know, but I had the gastric bypass 3 years ago. And with the gastric bypass, you're not supposed to take like aspirin, Aleve, ibuprofen, because it's risk of bleeding. And then even with a blood disorder, you're not supposed to take this stuff anyways. But that's the only things that really help. I maxed out on my Fioricet, which is for migraines. But I've been taking that since I was 15 years old. It was time to get off it. It doesn't do anything. So now it's like a waiting game.
Have you ever tried, I think it's called Imitrex?
My mom takes that, and she actually told me to ask the neurologist, but it's so hard because with the gastric and then my blood disorder and everything, it's like weighing what is safe, what is not safe. They don't know. So they're like scared of anything with me because they're like, we don't want you to develop ulcers or bleed out and die. I'm like, great. I'm just going to suffer forever.
Yeah, I mean, and that's a really valid concern. I mean, the main reason I asked about that is because a fellow Spinny sister and I were talking about migraines today, and we both take Imitrex. And I was talking about, and I'm wondering if you ever had this issue, but with some of those rescue migraine medications, a kind of a side effect after taking them is, I call them zingers, where you kind of feel like your head is buzzing. It's just the weirdest feeling. And so your head is starting to kind of let the pain go, but now it's zinging.
Oof.
Have you felt
No.
that before? Okay. Just me. Yeah, it's a weird feeling. Gosh, I wish I could help you. I mean, I'm sure you tried all the things like ice packs and heat and all the things.
Yeah, they
Yeah,
recently had me try a medication. I don't know if anybody on here has taken it, probably so, but Cymbalta. And I had a adverse drug allergy from that. I almost ended up in the hospital. So that was lovely. So yeah.
and that's an antidepressant, right?
Yeah, but I found out that they also use it for like chronic pain and arthritis at the same time, like fibromyalgia and stuff like that.
Yeah,
So they're like, maybe you can have like a for one special type deal. I'm like, I don't know, but we'll try. And then, yeah, within an hour, I was so sick. It was terrible.
that's awful. And I mean, there's a lot of medications out there that can kind of help with multiple things, and if it'll work for us, great, and if not, that really sucks. But it would be nice if they could find something to help give you some relief.
God knows, right?
Okay, so we're going to kind of switch directions for a second. Part of why I wanted to bring you on here is Rare Disease Day is coming up, and I really want to share about your son on Rare Disease Day. So I know you briefly talked about him in your last episode, but I really want to like dive in. I'm not even really sure the questions to ask you, but can you please tell everyone about, you know, what that journey's been like and what you guys are going through?
Yeah, Josiah will be 3 in March, so next month. He is a rambunctious toddler who, I swear, he reminds me of a Sour Patch Kid. He will give me a kiss and then choke me out. It's so funny because he's just like the personality's like there, like you can see his eyes glowing, like he is just over the top, out of control, but in a good way. He's just so funny.
I love it. And he's so and he reminds me so much of my grandson because my grandson's the same way. He'll like hit his mom and then be like, "I love you, mommy. Can I give kisses?"
It's ridiculous. And the thing is, it's like everybody's like, "Oh my god, he's the cutest kid ever." But in real life, if you come up to him, he will like growl at you because he does not like new people. So it's like, don't be fooled by the cute picture because my son will like bite your finger off. Like he is crazy.
I'm so
It's
trying
bad.
not to laugh. I'm trying. He's still so cute.
This is my life.
I just want to hug him and squeeze him.
So he has a rare disease called FCAS, or Familial Cold Autoinflammatory Syndrome, and it's like an umbrella for CAPS. And I can't say the first words, like chiropin, I'm pretty sure, associated protein syndromes. And unfortunately, Josiah fits in all three categories, so they didn't know where to place him because his symptoms are so severe and all over the place. But fitting under one, the treatment's still the same, so it really didn't matter. So with this condition right now, there's less than 400 people in the world with it. We are the only known people in New York, which makes it harder because nobody really knows how to treat my son, so we're all over the place. And I'm trying to think. His variant is the NLRP3 gene, and it's just so much in my head. It's all jumbled, so I'm like trying to get it out correctly.
That's
So
okay.
with this gene, it's either they're like half mutated or they're fully mutated, or there's like a little like chromosome deletion thing. Well, my son had to be the extra one and have the whole deletion of the gene. Like, I don't understand, but he is special in his own way. And he's actually the fourth person in the world with this whole deletion of this gene. And my husband also actually carries this full deletion but has no symptoms. He's just a carrier. So we got lucky.
Wow. Okay, so what does this mean for if you were to have future children?
So we went to a genetic counselor because that was my main question, because we wanted to have more kids. I always wanted a big family. I wanted, like, if I could have 100 kids, I would. I love being a mom. My husband thinks I'm crazy, but it is what it is. So we went there, and it's a dominant trait. So we have a 50% chance every time that our kid will have this rare disease. So it's really, the balls aren't in our court. Either we can have another kid and pray to God we don't have another Josiah, or we do.
Wow. I mean, because obviously you love him and you would never want to replace him, but also do you want to take chances of having another kid to care for that's dealing with that same thing? And now you're getting to see how it's affecting him. So for lack of a better way of saying it, it's almost like, do I want to take the gamble, or what are my other options?
Yeah. I mean, it's hard because, I always say that there's worse conditions out there that my son could have. I'm blessed and lucky that Josiah isn't as bad as some other kids out there. I'm lucky. But at the same time, my son isn't the normal toddler that's playing and jumping and running and can be outside building a snowman and doing the normal toddler thing. So it's like, I get in my feelings sometimes. I really do. I cry and I'm like, oh my God, like my life is over. And then I just get up and I'm like, stop crying. Like, you're crazy. Like, you have the best life ever. You are educating yourself and everybody else. Yes, he suffers a little bit, but I do too. We'll make it work.
Well, and it's like I tell everyone I come across, the things we go through make us better people. And the things we go through might really freaking suck. But sometimes I feel like I wouldn't change it for the world because it's made me the better person that I am. And I'm almost afraid to say that to people like you because I don't want to see you struggling and suffering or struggling with taking care of your son and worrying about your son. But at the same time, these things make us who we are and they make us better people too. Calling all Spoonies. As a host of a chronic illness podcast, nothing lights up my day more than hearing from you, our incredible listeners. Whether it's a topic close to your heart that you want us to uncover, or you are keen to show your own journey as a guest on our show, your voice matters. Living with chronic illness can often feel isolating, but through the power of podcasting, we can come together as a community to uplift, educate, and inspire one another. Your stories, insights, and questions drive the conversations we have and the topics we explore. So if there's something on your mind, a story that you are just itching to share, or a guest you'd love to hear from, don't hesitate to reach out. Your voice is not only welcomed here, but celebrated. Let's continue to amplify the voices of those living with chronic illnesses and create a space where everyone feels heard, supported, and empowered. Together, we are stronger.
Yeah, I totally agree. Like, before I had kids, I wanted to be in the FBI. I got my criminal justice degree. I wanted to be like a lawyer. I was super cool and confident. And then I had Jace, and I was like, I think I want to be a nurse. My kid is kind of special needs. He got diagnosed with autism. I'm like, maybe I want to work as like maybe like a therapist or something. But then when I had Josiah, that's when I found my passion of becoming like a nurse practitioner in rheumatology, because it's needed. There's nothing there. And I hate saying that, but since COVID, we have some of the most incompetent graduate nurses that I've seen. And that's just the truth, because they aren't getting the clinical hours. They're not having the same standards. And it's sad because we're the ones that are cheated as patients, and even my son. So I want to be different, and I want to change the perspective of patients and change lives.
And I think you are. I think you're going to be a life changer for sure. And I cannot wait to see you. I sure hope you go into rheumatology because we need more people like you. We do. We need your brain and your compassion.
Yeah. Am I crazy?
We're all a little crazy. Can you kind of walk us through what his life is like? What is he going through and what is he dealing with?
So Josiah, I'll just start from like birth because I feel like it makes more sense. Mother's intuition, I think I said this the last time, mother's intuition is never wrong. I knew there was something wrong with my son when I was pregnant. I had HELP syndrome. I had infections after infections. I was actually in the hospital like the last 12 weeks of my pregnancy because I was so sick. Julius found me unresponsive in the bathtub, turning purple, and he rushed me to the ER. And my kidneys and liver and everything was just so inflamed and not doing well. So I went through like 13 to 15 antibiotics. It was horrible. And then Josiah was born at 36 weeks because his heart rate was over 300. He had fetal tachycardia syndrome. So yeah, he was born. He wasn't breathing. It took him a little bit to get him breathing, which sometimes is normal with a C-section. And then we found out he was severely jaundiced, and then he got like a rash all over his body, which is not normal. And actually one of the first signs of CAPS or FCAS is a full body rash at birth. They were just like, he's jaundiced. It's okay. I'm like, no, definitely not. So by 11 days old, we were rushed to the children's hospital about 2 hours away. He was having seizures and they thought he had meningitis. So he was on so many different antibiotics. And that's when I found out he was allergic to Keflex and penicillins. So love that for him. Yeah. And then he was fine technically because all the infections ended up going away. So they discharged us after about a month at the pediatric ICU. It was a long couple weeks, especially recovering from a C-section and sleeping on a hard couch with a newborn, trying to feed him and having stitches. And it was just terrible. My husband was working and my other son was 2 and he was 2 hours away. So I developed really bad postpartum depression at that time. It was just a rough time. So I try to like block it out, but these are like the highlights, I feel like. So we get home, everything is grand, but he ended up having like failure to thrive. He didn't roll over. He never crawled. He wasn't hitting any of his milestones. And then he kept getting like fevers and swollen lymph nodes and like bulk infections. He would get COVID and RSV at the same time, or flu and RSV, or like adenovirus. Like it was just like weird. It was weird. It was not like Jace. So like we brought him into the pediatrician every week. They actually thought it was crazy. They thought I had like a case of Munchausen by proxy because I was bringing him in so much and he was so sick. It was such gaslighting. It was horrible. And then finally, after bringing in like a diary and them doing like real notes, they were like, okay, he needs to like be seen. So we saw, what was it? I think infectious disease. And they did some testing and they found out like some of his vaccine titers weren't up to par. And that also is a cause of infection. So we did boosters and then they were like, okay, we're going to do like a genetic panel. But they thought he had PFAPA, which is an autoinflammatory disease, but it's like the most common one and you outgrow it. I was not having that. I was like, no, we're going to do genetic testing. And that's when they found out he had the deletion. It was actually 3 days before Thanksgiving. I was trying to think which holiday it was. But they didn't know what to do. So they're like, we're going to consult with a rheumatologist because this is not our expertise. This is not like a primary deficiency disorder. This is autoinflammatory cases. You're going to go here. So I felt like a little gaslighted by that rheumatologist because they're like, it's lupus. I'm like, this is not lupus. Like, I get it, boys. It's very uncommon anyway in boys for lupus, but my whole family has lupus. This is not lupus at all. These are not the typical signs. So I kept pushing and pushing. And that's when they pulled out the textbook that was like 27 years old and was like, your son has a rare disease. We were wrong. And I cried. I'm not gonna lie. I cried. I was hysterical. I was just like, how are you going to sit there and like gaslight me for 20 months thinking I'm crazy? And here we are, a rare disease. Terrible.
Imagine that. Imagine that.
That was a mouthful. I am so sorry.
No apologies necessary. And I mean, this is a shout out to all those moms out there that, you're not crazy. You are the one that knows your child better than anyone. And, I've had many conversations for listeners that are not aware. My sister-in-law lived through this, and it makes me extremely passionate for the mamas out there because, she had notes written down in the chart of her child saying that mom was over worried, over exaggerating. I mean, just horrible things said about her. And it turns out that her child had a rare terminal disease that was going to take her life. It was genetic terminal illness that did. She took her child's life at 3. And so you and I have had many conversations regarding this. I think I even sent you her Instagram to give you a fellow mom. I don't know. Again, I think sometimes we live through the things that make us more compassionate, and seeing things like that, it surely does.
Yeah.
But no mom should have to feel, the way that you guys have felt. It's not right. And that's where the medical care system, it needs to change. People need to listen to the moms, or the parents out there better, and not just jump to conclusions that you're crazy or over worried or Munchausen, because there are normal parents out there that just want to help their child.
Yeah.
Sorry, I went on a tangent.
That's no, you're fine. I totally agree with you because there is so many parents, and I know many of us have watched this documentary on Netflix called Take Care of Maya. And
Yes.
that
Yes.
really hit home. I cried. I couldn't even get through it. It took me 4 times. I'm like, I couldn't even imagine that mom, because there were so many times where I just cried to my husband, and I'm like, I know there's something wrong. He's crying. He can't sleep. He's suffering. He's waking up. He can't walk. And they're just thinking I'm nuts. Like, that makes any mom suicidal, especially when they're already going through like postpartum depression or having mental illness. Like, it's terrible. I don't know. It just makes me so infuriated. Ugh.
And then to wonder how many moms, are having their children's taken out of their, well, not just moms, parents. How many parents are having their children taken out of their home because of things like that? And so for people that haven't watched the movie, if you think you can handle it, go check it out. But be prepared. It's emotional. You might want some tissues if you're a crier like me. Yeah, I mean, I could go on a tangent again. Sorry.
Yeah, that's how I talk about this stuff. I'm like, you know what? I'm going to get it all out. You're going to hear me complain. I'm a Karen. But you know what? There needs to be parents, because they feel probably so intimidated to say anything, and they feel isolated because they're like, I never heard of this disease before. We're the only one. Like, I felt isolated when I found out we were the only ones in New York. I'm like, where do we turn? There's nobody here for us. But having the advocacy and awareness and turning your socials into awareness for your children, I have gained like a family of support. And I feel closer to my support over social media than I do my own family, because you guys get it compared to my family and friends, which sucks.
It does suck. And I want to give a shout out. There's another podcast that, if people haven't listened to or checked it out, it's called Once Upon a Gene, with Effie Parks. And have you heard of it?
Yeah, I listened to her.
Okay. She's amazing. She's actually up north of me. I'm down near Portland, and she's up in the Seattle area. And she's such a sweetheart. I just love her to pieces. I don't have a rare child, but I feel like I get you guys just because I was an aunt of a rare child. And so to me, I get it. And so to me, I want to listen to these podcasts because I guess I want to educate myself as well.
Yeah. We need to have more awareness, and even like strangers and parents. I feel like this generation's a lot of judgment. And, Josiah also has severe autism, but with his rare disease, it also causes neurological defects. So my kid does not act like the typical 2-year-old. He can come off a little bit aggressive, and he doesn't talk. And he's also a giant. His dad is 6'7", so he looks like a 6-year-old. And parents are so mean to us because they think he's 6 and just mean. And I'm like, no, he has autism and a rare disease and he had seizures and he's just not the typical child. Like, educate yourself. Do not be so mean. Not everybody leads the same life. And it's hard being not even a rare mom, but having kids with autism on the spectrum. It's different and it's difficult. And I wish it was not that way.
And don't jump to conclusions, people. Don't. Just stop it, knock it off right now, because sometimes what you think you see is not always what is reality. You're only seeing a glimpse of things when you're at a grocery store or a parking lot or a park or wherever it is you are. You're only seeing a micro look into someone's life. And so, have you gotten people, like random strangers, walk up to you and say things before?
We've gotten looks. I know Julius, one time he had the boys out and somebody said something to him, and my husband is the complete opposite of me. He is very like shy and he is not confrontational. Me, I will fight anybody anytime for my kids, but he's kind of like, okay, I'm gonna take my kids and walk away. And I wish I was there because he was very upset, but it also stems from familial aspects. Our families are very taboo because, we come from older generations that, autism really wasn't a thing back then. And mental illness and everything, it's like kind of keep it on the hush, like don't say anything. And me, I'm not like that. I like to raise awareness. So I definitely don't get along with my in-laws, and they're kind of embarrassed of my kids. They won't take them anywhere. But I mean, they're lost. I got good kids. So
It's their loss. I mean, that's what it boils down to. Anyone that
yeah.
doesn't want to take the time to enjoy your kids the way that you guys have, it's their loss. They're the ones missing out.
Yeah, for sure. I mean, my kids are crazy. They're rambunctious. They're a lot to handle. I always say, if you want to use a weapon in World War III, come take Jason, Josiah, because you will take them and bring them back within an hour. But they're great kids. They listen sometimes. I'm not going to lie. They're also toddlers and they know right from wrong and they push buttons. But they are the sweetest and best kids. And I would not trade them for anything. I mean, I don't get any sleep, but it's so worth it.
I wish you lived in Idaho, and then you could go hang out with my daughter because she's only a year older than you, and her son's turning 3 in July. So I'm like, oh my gosh, you guys could hang out all the time, be the bestest of buds. Your kids would get along because my grandson's a little crazy too. If you ever want to move, just move to Idaho. Just saying.
I'm ready to get out of New York. It's too cold over here.
Oh, I guess the part of Idaho that she lives in is actually pretty warm. It's called the Banana Belt. And it's like the warmer area. Like they don't get as much snow. They don't get as much of the cooler temperatures. It's kind of awesome. I'm considered kind of live in a Banana Belt area also. We're over near the ocean. And so we don't really get the snow. We don't really get the colder temperatures that I had on the other side of the state. It's kind of nice. We're in our rainy season, but
jealous.
It's almost over, I think. You can move here.
Yeah, I'm jealous. I live.
I'm totally a big fan of people moving near me. I would love it. We could hang out. I mean, I'm old enough to be your mom, but we could still hang out. I'll just pretend I'm your aunt. We'll go with that.
Whatever.
All right. Well, is there anything that we haven't covered that you think we need to bring up? We've been in many directions.
I don't think so. My life is a disaster, but I'm always here if anybody wants to talk. I mean, I love connecting with people. It's just, I always tell people, give me 3 to 5 business days to get back to you because my life is always a disaster. So.
Okay. You say that, but you always get right back to me, and you are just the sweetest, and I adore you. So I'm calling you out. I mean, I think it's lies. You say you're not going to get back to people, but you do. Give yourself a little credit.
That's true. Yeah.
All right. Well, I'm sure we're going to have you back on again, but my Spoonie sisters, I want you to really just listen well to this story. If you need to go back, re-listen to it again. And if you have lived, with what they're dealing with, reach out to Mackenzie. Lend some support. If you have helpful information or tools, lend that to her too. You guys have some big trips coming up to help your son, right?
Yeah, we are in the process now. Since my husband has joined the Army, we are switching insurances, which means we will be going to a new doctor in Virginia. And then we're also trying to either get to Boston or California. So it's like we're climbing this mountain, hoping we get to the top soon, pretty much.
Yeah. Yeah. And trying to make sure he always gets the medications that he needs to help him.
Oh, yeah, those
yeah.
injections.
So, I'll try to get some links from you to include in our show notes for everyone. You guys have fundraiser stuff that's always going on, it seems like, right? Or are they still going on?
Yeah. I mean, they're there. If people ask for them, then I give them. I don't know. I just kind of fell off with everything recently.
Well, I'm going to ask for them, and we're going to share them in the show notes. And if you want to support Kenzie and her family, please do so. Click on the link, show some love, and any amount helps, right? It could be $5, it could be $500. Everything helps. It all matters. And so just shower her with all that love and support. Okay?
Yay.
Okay. All right, my Spoonie sisters, until next time, don't forget your spoon. The information, opinions, and recommendations presented in this podcast are for general information only. Consult your own physician for any medical issues that you may be having. The information should not be taken as a replacement for medical, clinical, professional advice, diagnoses, or medical intervention. My Spoonie sisters and guests will not be held liable for any of the consequences of such action or inaction. Trigger warning. Some episodes may cover sensitive topics including, but not limited to, suicide, abuse, mental illness, and chronic disease. You are advised to refrain from listening if you are likely to be offended or adversely impacted by any of these topics. None of the guests or hosts will be responsible for your use of the information contained therein. Life is not merely to be alive, but to be well. Living a life with a chronic illness is best described with one word: unpredictable. Be Well's products are designed to make the unpredictable easier to deal with. Back when I was getting my infusions, I would have loved to have their adult zip hoodie. They even have one in pink. They also have everything from one-day pill holders to urgency buckets. So remember, they want to make your life a little easier. So be sure to check out Be Well.